Welcome to Beyond the Frontline podcast, where your host, U.S. Air Force veteran Donna Hoffmeyer, will help you transition from the front line to the home front. Listen every other Wednesday as we'll bring great conversations, resources, tips, and feel-good stories that will resonate and relate. Now, here's your host, Donna Hoffmeyer.
Hey everyone, this is Donna with Beyond the Frontline. And this week we are going to talk about something kind of interesting called Champ VA. So a lot of us older timers might have remembered things that we think of like Champus and those 1980s kind of healthcare, financial, I guess, insurance type things or veteran insurances that we had back in the day. But this is a little different. This is Champ VA, and it has been around for a long time. But I brought on somebody that's going to talk about Champ VA and what it is and how it can actually help families. And he's going to get into all those details. But the other thing we want to highlight is how people kind of fill the gap. And I'm going to bring on Lucas Predmore, and he's going to tell us a very interesting story on how he got into Champ VA and the business that he's in right now called ValorWell. But Lucas, he is a veteran who served 4 years in the Army Infantry, and then he had a deployment to Afghanistan. And after he transitioned out, he went into healthcare for about a decade, and then he saw a gap through some of his own life experiences. And he ended up founding what's called ValorWell. So we're going to talk about that and what it is. Lucas, welcome.
Thank you for having me on.
Well, let's start from the beginning. So explain Army, you started life there, and how you end up now running ValorWell and working Champ VA. That's like a very fun.
Yeah,
what were you doing in the Army?
So I was infantry. So
so even further away.
Right, about as far away from it as you can get. Yeah, so I did 4 years in the infantry. You know, when I got out, I still wanted to do something that was impactful, that made a difference. So went into healthcare, doing physical therapy. Really enjoyed what I was doing there. But then over time, started seeing a lot of these issues where, you know, for mental health for veterans trying to get into the VA, it's awful. It's such a painstaking process. And like a lot of people, I just kind of was like, hey, I want to do something sometime. Someone should do something, and maybe eventually I'll do something about this.
Were you seeing this with the veterans that you were taking care of, like how they were struggling, or?
Seeing it with them, seeing it with, you know, my own life, myself trying to get through the VA. Every time you call them up, they're months and months out.
Mm-hmm.
Had a lot of patients that I was seeing that were talking about those problems and needing to get into the VA, but they just weren't able to do so. And then it hit a point where my own kids, so we were struggling to find mental health, any kind of providers who would take our VA insurance, and no one was willing to take it. Couldn't find anyone. We had been dealing with paying out of pocket and then sending in for reimbursement, which is its own special kind of hell to go through that process. We've been doing that for about 2 years. And finally we just said, hey, this is enough. Can't keep doing that. It's so stressful going through it. And ironically, my hope was never to actually start anything. I just reached out to some people that did accept that insurance in other areas of the country and found out how to do it, and then reached out to several other mental health clinics around here and asked them, hey, can you guys get set up with this? I know what to do. I can get you set up. You don't have to pay me. I just don't want to ever have to mess with this ever again. And everyone said absolutely not. You mentioned VA insurance, and people already want to, you know, they already want to not deal with it.
When you say VA insurance, are you talking like community care?
So community care, B1, TRICARE, and Champ VA. So those are the three big ones. And already as it is, no one wants to mess with those.
Yeah.
And then when you mention Champ VA, which is they just handle it in a completely different way than any other insurance in the country operates.
Well, before you get into that, I want you to tell
Yeah.
the story because I still think it's so cute when you were saying how you guys were kind of like struggling. You were sick of,
Oh,
submitting and it would take months or wouldn't happen or, it was like on repeat, right? And so
yeah.
you tell us the story about when you were talking to your wife.
Right. So after I had talked to all these companies asking them to get set up with the VA and everyone said absolutely not, I was just sitting there one night so frustrated and just utterly defeated. And out of that, I just randomly said to my wife, like, babe, let's just start our own mental health company. Let's just start it. We'll hire someone to see the kids. We'll pay them, direct, and we'll just handle the billing on the back end. Like, let's just do that. And yeah, I said it in the way that most guys have said stuff to their wives, where we say something that we know they're going to say that's dumb. Like,
So
you
you
are
were waiting for it.
absolutely right. Yeah, like waiting for that "you are crazy" response to come from her. But yeah, she just looked me dead in the face without hesitation and said, "That is exactly what we should do, but not just for us. We need to do this for everybody because we've come across hundreds of other families who are dealing with the same struggle." And she said, "Who would we be if we only did this for us?"
You're like, oh man. No,
Right, right. Yeah, it was like,
that
one
wasn't
of
the
those
answer.
moments, right? It was one of those moments like being in church where they say something that's like, man, that's like really uplifting, but also really convicting all at once.
She got you right there.
Yeah, so it was,
You're like,
but yeah, so we
okay.
were like, all right, we're gonna do this.
So
Uh,
explain. So we were just talking, just for the audience. Explain the differences of, and we have civilians that listen too. So explain the difference between
yeah,
TRICARE and community care and Champ VA, and end it with Champ VA so you can kind of get into those details.
yeah. So so you got TRICARE that's set up, and that's what a lot of people when they're in the families will have TRICARE, like if they're in the military.
Right.
If they medically retire or retire after 20 years, then they'll usually have TRICARE.
Yeah, you have to
Then you
be
have,
retired, medically retired over 30% or more. Then you can get
yeah,
TRICARE. Yep.
yep. And under TRICARE, there's a whole bunch of different
Oh,
programs
yes.
within that. So each one has their own specific requirements.
Hell.
Then you've got community care, which it's still a fairly new program. It's been out for a couple of years, where the VA said, hey, we recognize that we can't service all these people. When we have people who are needing a service that we don't have near them, or we could do it, but it's going to take way too long to get them in, then they have a network of other providers that they can refer people out to.
And I think it's over 28 days. I think that's the
I,
number. If you wait over
yeah,
28 days for an appointment, they're supposed to refer you out and under community care if you want to do that.
right.
Mm.
So we've got that, and that process is, it's a good program, but it's very difficult to get set up.
Mm-hmm.
And yeah, I know whenever I've used it before, like for myself, when I go in and they say, yeah, we'll refer you to community care, and they give you a list, but you end up getting a list of people that no longer accept it. I think I went 10 people down the list, and every one of them was like, no, I'm not taking that anymore. Or, I only accept that whenever my caseload drops.
Wow.
So it's just kind of useless. And then you have
Yeah.
Champ VA, which it's a special program for family members of vets who are either killed in combat, or if they are 100% permanent total disabled.
Oh, we should make a point before you go any further on the community
Yeah.
care. It's only for the veteran. That's it.
Correct.
That's just to be clear. When you
Yeah.
said families, it just dawned on me. Yeah. Go ahead. Sorry.
Yeah. Community care is just for the vets.
Mm-hmm.
And then Champ VA is just for the families.
Right.
So if you've got someone who they're 100% disabled, that vet would have to go to the VA, but their family would have community care. So and it's a really good insurance. I will say it's like Champ VA is a very good program. They cover pretty much everything. There's very few pre-authorizations that you need.
Really?
Yeah. For most things, if you get in and if you have someone say, yeah, this is medically necessary,
Mm-hmm.
you don't have to get a general practitioner provider to go to that. Whereas some insurances, you have to get an approval or a pre-authorization for every single one.
Oh, TRICARE. Well, it was Prime. I don't remember what they call it now, but you have to get pre-authorized to do, I think, anything but mental health. I think mental health you can go direct, but otherwise, yeah, everything's a pre-authorization.
Yeah.
And
So it is good. There's also no premiums or the copays and all that. So it's a fantastic program. The problem with it is,
well, let me ask
oh,
this before you said that. There's no copays?
so you have to pay. What they do is they'll cover 75% of
Okay.
the cost of care, and then you're responsible for 25% up until you hit 3,000 a year for the whole family.
Oh, okay.
Once you hit that,
You're
then
done.
yeah, everything is covered 100%. And there's not copays. They call it a co-insurance cost, but after you've hit that $3,000,
The threshold. Yeah.
yeah, once you've hit that, if you go somewhere, they won't charge you copays either.
Oh.
So it's really good. The problem with it is that so they do this system called it's open access. So they don't do any networks. And where that becomes problematic is, yeah, anyone can sign up for them, but a lot of places don't even realize that they can take it. So if you go to a provider and you ask them, hey, do you take this insurance? Like we've had so many places we go and we say, do you take Champ VA? They will tell you no because they check to see who they're in network with. And since there's no
Oh.
network, it'll show up that they don't take it.
So is that where you
Yeah.
come in ValorWell?
So kind of. Well, and just for everyone listening here, if they have Champ VA, or no, the way to get around that is you have to talk to the billing department of whoever you're going to and ask them if they accept or if they bill to payer code 84146, which is
Hmm.
again just a hassle that no one would think about. No one knows.
No, at all. I'm listening to you like, okay, take a note.
Right.
84146.
Right. But for like people who do have that insurance, that's the ticket. I've had several doctors I've gone to and they said, no, we don't take that insurance. And you go, hey, do you bill to that payer? And they go, oh yeah, we do that. I'm like, okay, so
So
you
you
do
do
take it.
take that insurance. You just don't know
Right.
it.
Yeah. So there's very few places that take it and even less that know if they take it.
Do
So,
you find them more like, for example, so TRICARE pays
mhm,
horribly, right?
yeah,
It used to be that I used to say like, well, it gives you the best coverage for you, but literally is the worst for the providers. And now it's starting to turn bad for both sides because now, as Prime, I still have to go pay copays for
right.
anybody. My daughter had PT, and they're like, "Hey, yeah, we're sorry, but it's a $37 copay." I'm like, "I'm Prime." Yeah, I know. Oh, that's nice.
Yep. Yeah, it's rough. And Champ VA is the same way as far as the providers. They reimburse so low, and that's the problem is you have a lot of professionals that want to work with the VA, but then they go, why would I spend more time, more paperwork, and all like more hassles when like especially for mental health, a lot of these people, they can get as much or more with people just paying out of
Correct.
pocket.
Well, okay, so true, yes, 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 and yes, and it's funny. So one of the things I've learned, and correct me if I'm off anywhere, because,
Hmm.
but so I do acupuncture, and I went to my person because I just pay out of pocket. Why? Because I don't want to go through the VA hassle, and I am lucky enough I can do that. And then they only give you like 20 appointments at a time, and then you have to go
Hmm.
back and justify needing more. And I'm like, okay, I just need it, so I'm going to go do it. Anyways, long story short, I said, hey, have you thought about doing community care? And so she went and looked into it. She goes, oh, I'd love to. Because I'm like, oh, it'd be great to get more veterans in here, and this is such a great practice and et cetera, et cetera. Okay. So she went through the process and I go, well, how'd it go? She goes, well, because I don't take insurance to begin with. She's like, they said that they can't accept me. So that's number one. The
Hmm.
second part of it, they accept only so many people in each area. And when I say so few is more accurate, like
Yeah.
we're here in San Antonio, there's a lot of bedroom communities. So there's like Shirts and Cibolo and New Braunfels and all these little communities. And I think each community, I don't even think each one, but like New Braunfels has like one or maybe two. And it's a
Yep.
city. And I'm like, the heck? And so they can't find these practitioners, or they're like 40 miles away in a city, which is
Hmm.
not great. So
Right.
they put all these boundaries around it that just makes it not attainable. And then here's another fact. Some places, I'm not going to speak for every VA because we all know they're like a franchise. They all work on their own.
Right.
They all work independently. But there was one, and I'm not going to name it, but a friend of mine running a nonprofit went to them to say, we would love you to come out and talk about community care. We're in a rural area, and this would be really good to talk about this. And you know what their answer was? And I kid you not. Oh, yeah, no, we don't want to do that. We want them coming to the VA. She called me in disbelief. She goes, I had to ask if I heard
Uh,
that right. So there's so many limitations around it and then people are hurting, or they're dealing with physical or mental health issues, and they just start giving up after a while. They're like, never mind. Like
yeah.
it's easier to suffer than it is to try to get help.
It really is, and I think you're hitting the nail on the head there. They make it very, very difficult, and it seems intentional. And
Mm-hmm.
and this is where I always tell people when I'm talking about the VA, I differentiate very strongly between the medical staff and the
The
administration
process. Yes, I
because
agree.
yeah, like I will say up here in Kansas City,
Mm-hmm.
the VA that we have, I have never received better care anywhere in my life than when I go there. Actually getting to there is the worst process ever.
Yeah.
Like it's so hard to actually get set up and get started. And I think that a lot of the people there, I think most of them want to do the right thing. They want to help. The problem at the VA, from what I've seen talking with a lot of the people that work there, is no one knows what's going on outside of their 5 foot area.
Bingo. You
It's
just said what
so,
was going in my head. They're all working in a
yeah,
bubble.
it's so broken apart that you go in and you ask someone, hey, like, how do I do this? And they're like, well, you have to have this stuff for me, to help you. Like, okay, where do I get that? I don't know. I just know you got to have it. They're like, oh my gosh.
Good
It's
luck.
right. And I'm sure it's just as frustrating for them as it is for everyone else going through. And you think about it, like if I was in that situation where my hands were tied and I couldn't do much, and I got people coming in all the time asking questions, and you can't give them an answer. eventually you get so desensitized that you're just like, whatever.
Compassion fatigue. Yeah. Yeah,
Yeah.
they really are. I agree wholeheartedly because I have heard
Yeah.
great things about some of the caregiving, but you got to get to them. And then they
Yeah.
can only go so far. They don't. When I was in the military, part of what I did was I got to kind of run across different lanes, you know? So if
Hmm.
somebody was going in for mental health care, and of course, the military does not have high level care, like they only have like, well, we're lucky we got, I mean, again, we're differentiating the caregivers versus the process. But they're only have like if you have general anxiety or depression or very mild PTSD and you need to be seen once a week, you're probably okay. Like you'll probably get in
Hmm.
there most of the time. But anything that's a step up, and if you need an IOP or like higher level care, PHP, like ain't happening. Like
Right.
we have to refer out. So as soon as they go out, these are my service members, so I'm tracking them and I
Hmm.
know where they are. Okay, they're inpatient. They're going to be there 3 to 7 days, depending on what's going on. And I'm already figuring out the next place for them to be. And I'm already talking to the therapist to say, hey, I'm sure, I always catered to them and said, I'm sure you have your places, which often they didn't, and not against them, but it's
Hmm.
the environment they were in. But here's some places that I think might work. And boy, 9 times out of 10, they're like, oh, thank you. I'm like, please look at them. If you have any questions, I've talked to all these, whatever. And then we'd find the next location. And then when we had to step down one more time, like IOP, I was always ahead of that till we got them back down
Yeah.
to regular therapy. Why? Because if I didn't, I'm going to have them back in inpatient. That's what's going to
Hmm.
happen.
And that's how it should be, is set up that continuum of care
Yes.
and always be discharge planning for the next step.
Always. And you
Yeah.
know what's weird? The rule of thumb in all my years of nursing was that you were starting your discharge planning on admission, right?
Yep.
But that doesn't help. That does not happen in mental health care.
No.
It does not happen. The inpatient has their inpatient stuff, and PHP has their PHP, and there's no help from one to the other. And if it is, it's very, very rare, that kind of thing. So
Yeah.
it's a
Care
little rabbit
coordination is
hole, but
it's very limited, and it's on the point you were talking about earlier, where like the difficulties in getting set up with community care.
yeah.
Yeah, because it's depending which part of the country you're in, you got either Aetna or TRICARE that manages community care. And my gosh, when you go through and actually set up your approval, like through Aetna and everywhere else, just that part, there's like 5 different registrations that you got to do
Well,
along the
Lord.
way.
And if you
And
miss
every
one,
right. Well, I mean, we've signed up so many therapists under that, and I still can't give you a like step by step, this is how it goes, because I feel like it changes constantly, or every time we do it and we try to do it the same way and someone's like, no, that's not the right way, and or there's this other step here, and like, guys, like, why is this so difficult? And that's kind of you know what we're trying to solve with ValorWell here is we've got the Champ VA thing figured out, and now we're looking to break into community care a little more. We're basically like the eastern half of the country, we're set up to be able to take it.
explain exactly like what ValorWell's role is like in there. I think we've talked around it a little bit, but explain exactly
Yeah.
what you guys do.
Yeah, so what we do is basically we've registered our company with these insurances, and then whenever therapists reach out and say, "Hey, I want to work with you guys," we will take care of their registration under our umbrella. Then they'll treat patients. So we have our platform where patients who have those types of insurances, they can come to us and we can start seeing them. So we connect them to the therapists.
Okay.
The therapists do their treatment, and then we basically purchase their billing from them, and we handle all the VA payments on the
So the
back end, all
therapist,
the
so the
insurance.
therapists just have to do the therapy.
Right.
You handle, you're like the billing station, the admin part of it. And right
Hmm.
now your connection is through Champ. You're doing all this through Champ VA. And now your
Correct.
next step is we're going to do this, but we're going to do this with community care. Keep me in the loop on
Hmm.
how that one goes.
Yeah, it's going to be tough. Part of the struggle for us with that is getting our infrastructure in place so we can handle, once we start pushing that, because I know we're going to get a lot of people, like a lot more that are coming in and needing it. But yeah, it's tough.
Do
But us doing what we're doing and being able to provide the therapist that, avenue to be able to do this
mhm.
is so powerful. Because one of the things we found is there's no shortage of people that want to work with vets and their families. But
That's a good statement to hear because it doesn't feel like that sometimes.
right, they all want to do it. They just don't know how.
Hmm.
Or when they do try, and they're like, "Oh my gosh, this is way more of a headache." So when we provide a platform where they can come in and, like you said, they just have to do the therapy. They just have to take care of the patient. That is it. They don't have to market. They don't have to try to chase down, patients. We handle all of that, and then we handle all of the billing on the back end so they can just focus on taking care of the patient. They have the security of knowing, hey, I'm going to get paid. We don't make them have to wait until reimbursement comes back. So if there's any kind of a disconnect or issues where the VA is giving us trouble, that's something that we bear the brunt of
But you
as
still
a
pay
company.
them on time. Do you work
Oh yeah.
with just individual therapists or do you work with like what if I'm thinking if there's like an
Mhm.
established group practice already that has their own billing office and all that other stuff, do you work with them and say, we're just take care of all your veteran stuff?
We've we've got some. We're piloting a thing right now where we do have some clinics that are doing that, where they've been trying to get this stuff set up, couldn't do it, and then they reached out to us and said, "Hey, can we have you take care of our billing? Can you submit
Connect
that
us.
stuff?" Yeah, and we are working on that. If anyone's listening to this and going, "Ooh, that I want to do that," reach out to us. But we are planning to start that officially in early 2025.
So this is kind of neat because it's
Yeah.
like a subcontract sort of like so if there's
Hmm.
a therapist or and it's all just mental health right now, right? That's
Yeah,
the
right now
focus.
it's just mental health. We're focusing on that because, we're trying to focus on the areas that we can do virtually
Yeah.
as much as possible. So, we've got that. Psychiatry is a big one we're wanting to step into as well. Then things like speech therapy.
But let me tell
A
you,
lot of,
psychiatry is wise to get into because what a pain in the butt to, do the therapy. And then you got to go find somebody else. And it's all about that communication, right? So somebody's over here that's doing your meds, and then somebody's on the other side over here doing the therapy. And neither the
hmm
two connect, or it's just a quick, there's no relationship, like here's
right.
your drugs and oh, the therapist says you're doing good. Okay. Like there's
And that's
more.
usually how it is.
Oh, very much so. I mean,
Yeah.
my oldest has ADHD, and he is on medication for that. And I we needed when I got out of the military, he needed somebody to prescribe his medication. So it had to be. We were a short time off base. That's what was happening. So we had to find like a psychiatrist or another PCM. Well, anyways, long story short, we found a nurse practitioner, psychiatric nurse practitioner, and they could prescribe the meds. And it was great because we needed that. And he was doing neurofeedback, which was handling a lot of, like, we didn't need as much medication because of it. But
hmm
I would have to go every, I don't know, once every month, once every couple months. But they didn't know what he was doing. I have to go there and drive 30, 40 minutes and I'd sit there and they would ask the same 5 questions and I'd be like, yes, he's doing fine. No, he's not having an issue. Oh, okay. Boom. same
Hmm.
medication. There's no relationship there, you know? I mean,
There,
that's not mental health. I mean,
yeah.
it's brain, but I mean, it's still just the fact of having to go to somebody that doesn't even really know what's going on with them, you know?
Well, the problem is, I think healthcare in general anymore, that's kind of how it is. You know,
It's
you
very
go,
disconnected.
yeah, you go see someone, and even the doctors, I can't tell you how many patients that I saw in physical therapy that they would go see a doctor, and the doctor had no clue what was going on with them. Had a lady who, God, she was having all this like horrific pain. Ended up, they thought it was an issue with her kidneys. She went in, got that checked, and then went back like a month later to do the follow up. And I remember talking to her when I saw her, like, "Hey, how'd your appointment go?" And she said, "I don't know, like, went good. He said there was nothing wrong with my kidneys." And it's like, "All right, well, did he say what it was?" And she was, "No, no, he didn't say what he thought it was." And I was like, "Okay, did he actually say it wasn't that?" And she said, "No, he just didn't say anything about it, so I assumed it was fine."
Okay. Yeah.
And yeah, then we called back, got a hold of the doctor, and oh yeah, yeah, like those tests did come back positive. But the doctor had been just so pressed for time. You know, he sees, "Hey, I got an
Yes.
appointment. Hey, how's it going? Any issues? No, you're good. Awesome." Like, unless you tell them this
Yeah.
is what's going on, and it's tough. But I think that's where we can make such a difference. And you know, we've been thinking this last year real hard about the next steps as we go, like what services to bring in, and how do we address this bigger gap across all areas of healthcare, especially with Champier. And that's when we kind of realized that, you know, if we go at this where we try to bring in our own clinicians for all this stuff, that is, first of all, way more management on our end. A lot of
Mm.
these things you need physical locations for. And we just kind of realized that, you know, we could do this where we just open it up for other providers to come on and use us as a dedicated billing service.
For on the veteran side, that's
Yeah.
it's kind
Hmm.
of brilliant. I don't even know if this anybody exists anywhere because really, you know, here you come from this like, hey, I'm struggling to get care for my kids and I'm struggling to like it costs a lot and I'm taking forever to get reimbursed or I'm not getting reimbursed and I'm spending more time chasing it. You probably spent
Yeah.
just as much in postage stamps trying to,
Oh
you
my
know,
gosh.
get
It's
that
I
back.
can't even get into that process. It is such a hell. I mean,
Yeah.
years. We've gotten stuff back. We've gotten stuff back from them that was years
Oh my
ago.
goodness.
Right. It's stuff that you just
Unacceptable.
like just write it off like whatever. This is never coming back. That's just gone. And then yeah, years later, you're like, oh my gosh. But that's where like if we can go through, I mean, the ultimate way to do this would be is if they just fix the system. But
That's
at the end of the day,
asking a
if they're not going
lot.
to do that, right? And it's funny because I always look at this and think, man, it's crazy to me that we are the solution to this. I'm probably the least qualified person in this field to do this, and the only thing that makes me in any way qualified is that we made the decision to do it.
Yeah.
And yeah.
Does ValorWell function as a nonprofit or is it a for profit or
So right now we are a for profit.
right?
So we had looked into a couple different ways of going about it, and ultimately we decided on for that part we wanted to keep it as a for profit for now because we want to make sure we're able to guide things the direction that we want it to go because I've seen a lot of nonprofits that, you know, especially if they don't have a real clear mission over like at the beginning,
Mm-hmm.
real strict, this is what we do, it's easy for them to get pulled in the wrong direction
Yeah. Yeah.
and get abused. So down the road, we're looking at possibly adjusting that, but we want that to be something where we're able to really guide it in the right direction and keep it with the right mission. Now, we
Yeah.
did start a nonprofit as well earlier this year, the ValorWell Foundation.
I was just going to say, you should just kind of add on, just start the foundation, which kind of
Yeah.
works.
Mm-hmm.
And
And
what
it
does it
was
focus on?
so the foundation focuses on paying for the gaps for providers in care. So one of the things that we came across with this was when we had started with Champ VA, they were like, "Hey, there's no minimum amounts on what the reimbursements are. So if you bill something, we don't have, or not a minimum, we don't have a maximum amount." And then we found out as we were going, they don't have a maximum amount. They look at every one of them by case basis
Mm.
and decide that it's pretty much the TRICARE amount for everything.
Oh,
And when we caught that and we realized that, man, like this this isn't going to work great, because at that point then we realized we're going to have to, like, we want to have the best clinicians, but to do that you got to pay really well. It's like, well, we can't run the company if we're getting reimbursed pretty much the amount that we
yeah.
have to pay our therapists. And that was a point where it hit me too, that that's why no one wants to work with community care or some of these other insurances on their own.
They'd go broke. They could not function if I mean, my God, I've
Absolutely.
seen these bills come in, the EOBs, and
Mm-hmm.
you look at them and I'm like, oh, look at that. That was like $700 and they paid 50. Who the
Yeah.
hell thinks that you're going to be able
And
to keep running a business
you
like
look
that?
at, right, you look at what is the average rates for even private pay in these areas, and it's sometimes
Atrocious.
almost double what those are. So it's
Oh,
like,
yeah.
man, how do we approach that? And at that point there, I was still working my full-time job, doing physical therapy and running ValorWell. I had no time at all in my life, and we were just kind of like, man, what do we do? And I felt like God's just over there background going, hey, start the foundation. Start the foundation, which at some point we had talked about that being a 2 year down the road thing
Mm-hmm.
to, like, help pay for, hey, vets that need coverage that were never able to get set up through the VA. We can set up a fund to be able to cover
Right.
them and to help them get through the VA process. But yeah, that was the point. It was like, all right, let's just, like, we have to do this now. This is not a 2 year down the road thing.
The service, just to make sure I'm clear, so
Yeah.
Well, God, my mouth is
Yeah.
all over the place. ValorWell Foundation fills that gap. So if there is somebody, a veteran that does not have VA coverage or
Hmm.
insurance in general, but they need mental health care or something like that,
Hmm.
you guys fill in.
We'll come in and we'll pay for them to get the coverage, or we'll
Hmm.
pay for them to get the treatments that they need,
Yep.
and then help them get that coverage. So
Nice.
one of the struggles that we have in the system is people are trying to get into the VA to get set up with mental health care, but they can't afford it. And the VA is saying, well, you don't have enough evidence to support that you have any issue.
Oh yeah, that's like
Like,
another whole ball game by itself.
right. So how do you get that if you don't have money
Right.
to pay to get it?
Chicken and the egg.
So so we're looking at, hey, we can provide them treatment, most importantly. We can get them set up so that the VA will continue to cover that
Hmm.
and anything else that they need. And the beautiful thing is, there's a lot of these companies out there that you go to and they'll charge you $1,000 to $3,000 for, like, a Nexus letter
Oh
from a
yeah.
one time right from a one-time visit. And but the problem is that when you go to the VA and they say, all right, well, that was a one-time visit, that doesn't really, we're not going to put much weight in that. Well, if we do get a denial and we come back and say, hey, this person is continuing to get this treatment. Here's someone who's seen them for 10, 15, 20 visits.
Right.
They're saying this is what's going on. They're saying this is caused by their time in service. So who is this other person that you've got who made a decision off of a 1-hour visit?
Yeah.
Like, we can completely overpower that.
So you're filling the other gap. Yeah.
Yeah. So that's a big part of what it's going to do. The other part is, so whenever providers do want to work with Champ VA or community care, some of these other services, so if they want to get set up, and we've got like one clinic that we're working with that they said we want to do this, but man, their reimbursement rates are all over the place. We need some kind of security there. So we looked at it and said, all right, well, what we'll do, we'll set this up to where they can submit to the VA, they get their reimbursement back, and let's say if they're billing $100 an hour for a service and the VA says, we're only going to cover $70. Well, they can send the remainder to our foundation, and the foundation will cover that gap.
Nice. Is it so? My mind's got like 8,000 thoughts in my head. So, how is the foundation being funded? Is it grants? Is it sponsor, donation?
We're pursuing grants right now. It's pretty much all donations.
Yeah.
And sponsors.
That's where it always starts. Yeah. And then is this nationwide?
Absolutely.
That's important because you mentioned you were at Kansas City, and I'm like, well, that's great for Kansas. What about the rest of the world? But it's nationwide, so they can reach. Yeah. And where can they get a hold of more information? Like, where would they reach out to?
So they can either go to ValorWell.org or ValorWellFoundation.org.
Perfect.
And get information on us. They can also, anyone can find us on Facebook or Instagram. Yeah. And yeah, we're trying to do everything that we can, make as big of a impact as we can to fill all these gaps.
Well, you're making a huge impact because when you and I talked in our pre-meet, I asked you, like, when did you start? And I think it was last year, right? This is whenever.
Yeah, and we started Veterans Day of 2023.
What was your expectation and what happened?
Yeah, so we started and we were expecting, I was like, man, maybe we can get 5, maybe 10 people by the end of 2023.
And you started November of 2023?
Yeah.
Okay, so that's reasonable, right? In 2 months, get about 10 people. That's good.
Right, and we didn't do any advertising. We created a Facebook page. Literally didn't post anything on it because that's just not my
specialty,
not my thing. The website was super basic, but yeah, so we're like, all right, like, let's do that. Once we figure things out, then we can start to scale it. And we had almost 100 people by the end of the year. We had 20 people in the first 2 weeks, and I was like, oh my God. Yeah, like we knew the need was big, but man,
was this clinicians or was this patients?
This is patients.
Patients. And now you're like, okay, I got to get the clinicians connected. Yeah, you got to scramble.
Right. And that's a whole, it's a whole beast trying to figure out, like, all right, like getting clinicians on and then trying to make sure we've got, like, finding the balance on getting clients in for the clinicians to see or having clinicians available for the patients when they do come on.
So you know what goes in my head? I'm like, holy cow, like what a connection and what a connector. Because I'm thinking, let's say in North Carolina, and rural area, and especially right now after Helene, right? A lot of these little tiny towns FEMA couldn't reach and they got wiped out, and they need resources. But in let's say the east side, which is the side that got hit the hardest, right? And on the west side, you have mental health therapists there, and you can make that connection by saying, hey, we'll take your backside and billing and do that.
Hmm.
And you're on the other side with people like saying, hey, I need help. Well, where are you at? I'm in North Carolina. And you're like, I got a therapist 6 hours away that can do telehealth with you. And that
Hmm.
person, that therapist, is willing to come on board because they know that ValorWell is going to pay them, not some 5 cents on the dollar,
Oh yeah,
reimbursement. They're going to pay them what, and they want to do this. They want to get in with the veterans, but they got to pay the bills too, right? So,
exactly.
what an amazing win, and what a incredible hub that you created, that all these people get to work with. I mean,
Yeah. I thank you very much.
that's a lot of, I mean, I'm tired just
It's
even thinking of how much work went into that, and
it's a lot.
you see the tip
It's
of the iceberg that says ValorWell, and nobody's looking underneath to see the massiveness that's supporting that tip, like what you did
yeah.
to
Well,
do
and
that.
what's amazing to me, as we've been growing this, we've had so many places that are asking like, okay, why if you can do this, why has no one else done it? Like that's been the big question we've had. Like, okay, like because I don't have any like I'm not a professional in this, like building a healthcare business. I'm as far out of my depth as anybody
You have
would be
tenacity
doing this.
though and
And
passion, and
right.
you
When they
looked
ask
at
that,
it from a need. Like, you're, man, children are
right,
definitely really good impetus to do something. I always joke with my husband, I'm like, the things we thought we'd never do.
right.
Why? Because
My
my
thing
kid's
is,
in need.
yeah, when I hear people say that, like, why is no one else doing this? And it's like, man, because healthcare has gotten so apathetic
Yes.
about these things where, you've got an issue that, I mean, for so long, mental health for vets has people been just yelling and talking about how big of a problem it is.
Mm-hmm.
And I think it's become this thing where, as a nation, we've just kind of looked at it and gone, yeah, that's a huge problem, but there's nothing we can do about it.
But
And
there
because of
is.
that, right. But when you like that's the thing is you have
Mm-hmm.
to look at it from a very like I'm going to do this attitude. Because when I feel like the focus for so long has been that yeah, it's a big problem. And we're focused on the problem rather than focusing on creating the solutions.
Well, I call it finding the yes. Stop looking for the
Yeah.
no. It's there. You don't have to look for it. It's right there. Go find the yes.
Hmm. I always tell my kids, I say, imagine that it's a legendary weapon on Fortnite, like whatever it is that you want to do. Because when I hear like, oh, like I don't have time to do this or I don't know how to do this, like, man, I bet if there was, on one of your games, if there's something you really wanted, my God, you're gonna figure it out.
You're going to
You're
find
you're
it.
gonna go through and do whatever it takes,
Oh,
be
yes.
creative, but you have to want it more than you're scared of the effort.
Yeah. Oh, that was my other question. When you're talking about this, do the providers and the clinic, do they pay a fee to your services? Like, how does that
So
work?
so right now, any clinicians that are like working with ValorWell, so they don't pay anything to us. They just treat the patients and we pay them. For anyone that comes in and we're gonna have where we just handle the billing for them,
Yeah.
where we are gonna charge something on that. Right now we're looking at between probably 3 to 5%. Basically not enough for us to make anything on,
Yeah.
but just enough to cover the cost of us doing it. Because that's not something that I want to I don't know, like sounds really corny, but it's not something I want to make money off of doing. I just want to make sure we have better access for everybody.
Yeah.
And that's the goal. It again sounds really stupid because
No, it
everyone
sounds like a veteran.
Like,
That's how we all are. Like we're
hmm
and all the entrepreneurs, civilians look at us like, y'all sad.
right.
Because
Yeah.
we want to solve
I
the problem. Like, it's not about the money
yeah.
for us.
Like I want to make sure that I can take care of my family, but we can do that without taking advantage of the
Yeah.
problem. And that's the big thing that we're, and that's again why we want to keep it as like ValorWell, not as we want to keep it just owned by us
Yeah.
because I'm so worried that if we bring in too many people because there is so much potential for what we're doing, and I want to make sure that it does stay pure to the mission. And yeah.
Gonna find the right. I completely understand what you're saying. I just had that talk with somebody the other day about scaling up, and somebody offered me like, hey, we could bring in people to help run, part of my because I have a
Mhm.
foundation, part of my foundation, and I was like, yeah. I said, but they got to have the right energy. They've got to have the right, like, it's not about just doing the event because that's easy, but are you putting the right energy? And if a veteran comes to you, are you willing to stop and help them? Are you willing to say,
Yeah.
let me look into it, let me reach out, let me bring somebody in, whatever this may be? Are you willing to do that? Are you able to kind of be more visionary, like moving stuff forward, but stop and come down to that single person and say, "Let me see if I can get you a resource."
Yeah.
That's not easy, and what I
It's
find is very few people can actually be visionary and tactical at any given moment. You're either one, or that you're either visual, strategic, operational, or tactical. You might float
yep.
between operational and tactical, but like strategic, maybe if you're like special forces, they gotta be more strategic. But you,
Yeah.
but mostly you're strategic and maybe visionary and operational and tactical. Like,
It's very hard to find that where it's not like you got someone who's just like head in the clouds,
yeah,
just like, oh, we do this, like, whoa, whoa, whoa. Or you got someone who's just like
head down.
very operational and like,
Yes.
but they're
Execute, execute,
almost
execute.
right. And when you try to break out of like, hey, can we do this? Can we change up what we're doing? Can we be a little more creative here? Or that? And they're like, no, 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 nope. This is how we do things. And
Yes.
trying to find that balance. And that's actually, I was talking to someone else about this recently, like how important it is to, like you said, bring in people who have the right mentality, the right vision. And that's been something else that, man, like we're so particular about who we bring on, even like as therapists and all, because, man, I want to make sure we have the best people. I don't
Yes.
want to have to be worried about, is this person going to be taking care of our clients the way
Yeah.
that we want them to? And the other thing is, from a management perspective, it makes life so much easier if you have people that you can trust in those situations, because I'm the kind that if I'm going to put someone in charge of something, I want them to be in charge of it and I don't have to mess with it. Like,
Spoken. That's exactly how I am. Like, I actually say this to, I work with this videographer, photographer. I hate taking selfies. I'm not a fan of any of this stuff. And when I do my business, I want my business to stand for itself, right?
hmm
And so when we've collaborated on a couple of things, and he's like, well, do you want to this, or what do you think about that? And I said, okay, here's the deal. This is the vision. This is the energy that I want with it. This is what I want it to show. You're the expert. Have a good
hmm
day. And he's like, and his comment, he's a veteran too. And his comment to me was, I wish more people were like this. And he goes, working with veterans is so different. And I was like, why? He's like, because you're like, do it. I'm like, yeah, but that's how we're trained. It's just like, you have your special area. We broke this mission down And that's your area to execute. So go do an amazing job in that area. And then I'll go do an amazing job in this area and we'll just come back. Yeah.
Yep. This is your lane. I've sectioned this off.
Right.
That's yours. I don't want to step over there. If
I
we
am,
need to,
if I am, I used to tell that to people all the time. Like, I am not a micromanager and I'm not going to get in your chili. So if I am, there's something that's off. We're off somewhere.
Right. And there's times where, hey, we'll need to step over, help each other out. But man,
sure.
If it's, at the end of the day, it's like, can you do this?
Yeah.
Like, my thing is, I always tell people, like, if I'm working with someone, and I had this when I was working in a clinical director at a facility a couple of years ago. We had a lot of this PRN staff that would come in, and I'm pretty much at their mercy. And my thing is, I would always tell them, listen, I'm not going to tell you how much time you have to give me each day, each week, whatever. You tell me what you can do, but I expect you to be able to follow that.
Yeah. And tell me when you're off. Yeah.
Right. If you can't do it, if I say, hey, I've got 20 patients that I need seen this week, and you can only see 10, don't tell me, yeah, I can.
Yeah, don't please me. Yeah, no.
Yeah, I think I can do that. Like, no, I'm fine with whatever you tell me, but if you tell me you can do this, and one of the things, talking about micromanaging that we did with ValorWell, that I also, I'm very proud of myself on this part here, is we started trying to look at, like, how do we handle documentation and things like that for, like, timeliness. So if I have someone, they see a patient, and you worked in healthcare.
Oh yeah.
You get all these times where
been in medical records many times, signing records.
Like, hey, do you have that note done? Like, I'm getting to it. Like, calm down. And I was like, man, I don't want to be having to micromanage, having to be going in and checking to make sure people get the stuff done, having to remind them on this stuff. So what we did was we kind of adjusted how we're doing things, and rather than paying per session that they complete, we pay per note that's completed in that pay period. Yeah. So it's like, hey, we're doing this way. Like, if you don't get it done during that pay period, I don't care.
Yeah, you just get it in the next one. And we understand you're overloaded, but it makes a complete package. Then you're done, and we know you're done, and everybody's done.
Yep. Like, that to me is the best way to do it, because then it's the responsibility is on each person. They can do that, and they don't, because it can destroy that relationship. Having that boss to employee or contractor relationship is tough anyway. But if we can give as much autonomy as we can to people, I think that's the best way to do it, where, like, hey, you just treat them. And at the end of the day, if you don't put your notes in, like, if you never do,
okay,
it's fine. It's not hurting me at all.
We save money, but yeah, you might want to wrap that up there a little. Yeah. But you know what's popping in my head too, and we'll wind it down after this, but I think of the clinicians and how, we've been kind of bashing the system a little because system's broken, and we know that. And we've made it very clear that it's not the practitioners, right? There's a lot of amazing practitioners out there, and we need to honor that. But they get ruled over by insurance companies, right? I'll tell you, I was pregnant with my first son, and I went in to see my doctor. I used to work with this guy, and I went in to see him, and he says to me, like, oh, it's a busy day today, Donna. He's like, I have 56 patients I saw today. Like, I was on the end of the day, and I looked at him. I'm like, that's not humanly possible. And he's like, it is when you work for insurance companies. And I was like, holy cow. Like, I don't even know how that happened, right? And he had to do deliveries somewhere in there, right?
Mm-hmm.
So they get pressured, right? You get 15 minutes. What do you do in 15 minutes? I don't care if it's mental health, physical health, any health. Like, what do you do in 15 minutes? Dude, like, can't have a cup of tea in 15 minutes, right? So when you're doing this with them, are you putting anything, are you just saying, go do the care? We're just here for the backside. When your note's done, we pay you. That's that. Like, you're not putting any stipulations on any of that, or are you, or do you
Nope.
have
As
to?
long as the way I look at it is, as long as like when we submit our billing, we haven't had any issues with documentation getting rejected or anything like that.
Hmm.
If we have an issue where someone, the insurance company comes back and says, "Hey, we need more documentation for this or
Oh,
more
yeah.
supporting," then like, okay, I'll go to someone and say, "Hey, if we're going to continue," because essentially what we're doing is purchasing their billing from them. So telling, if we're going to continue purchasing your billing, we got to make sure this happens.
Yeah.
But we haven't had anything like that, and we've got our platform set up to where it's set up to where the documentation should all be going through.
Oh,
Now, if
nice.
we have someone who is, like I don't know, if we had someone that's going in and they're just putting like, "Hey, we did therapy stuff." If they're
Yeah.
being real simple like that, and we start having issues, then we can, you know, we'll have a conversation with them.
Educate them a little bit. I actually,
Right.
I
But
actually
I
had a
but I don't go
company.
looking for problems. I don't go looking like, "Hey, let's go check your documentation." Like,
Right.
because I feel like a lot of companies, that's kind of what it is. They go through and like look for issues. They're nitpicking
Yeah.
and talking about getting overridden. Yeah, I've seen that and had it happen myself in clinics where you go through and you tell them, you tell your higher ups, this is what this patient needs, and either insurance company changes that, or your higher ups who have no idea, they've never seen this person at all, and they're going, I think you should do this here, or have you looked at maybe this diagnosis instead?
Mm,
And they look for ones that are paying higher
right.
or different things. And at the end of the day, it's like, I think we need to give that power and autonomy back to the clinicians
I agree.
as much as possible. Let them do their.
Amazing work.
Yeah.
That's good. No,
Hmm.
I think that's amazing what you're doing. And I think everything you're doing is just incredible. I love it. So do you have any last words before we wrap this up?
No, I think we've kind of covered everything, and I'm sure we go for hours more, but
Oh, we could. We talked forever the first time we talked. That's why I have pre-meets, because I
yeah.
avoid lots of rabbit holes.
Hmm.
Because I could talk to anybody.
But
But
yeah,
I
I would just
think,
say
go
anyone
ahead.
that's oh
Yep.
anyone that, if they're trying to find mental health care either through Champ VA or TRICARE, CommuniCare, anything like that, have them check us out on, like I said, Facebook or our website, valorwell.org, and we can we can make sure they get taken care of.
Yep, that's what I was going to put, call to action. That I think if you are right now a mental health provider and you are interested in helping veterans, but you're struggling to go through the process, or it's just too much and you literally have no time, then come talk to ValorWell and come talk to Luke and his team and see if they can help you get through the process. If you are a patient and you are struggling to get mental health care because you don't have VA or you don't have the right coverage or whatever's going on, go talk to them also. They might be able to connect you. They might be able to help you get benefits. And oh, there was one last thing I was going to ask you really fast, Luke. I
Hmm.
knew it. There was something that was bothering me this whole time and I couldn't remember it. If a provider doesn't take insurance, can they still work with you?
Absolutely.
That
Yep.
was a big one.
Even if they take no other insurance,
They can work
we
with
can
you. So that's a big
absolutely.
deal. So I know a lot of providers have been shying away from insurance, and we totally understand why. It gives a lot more freedom. You actually get paid. We get it. So
Hmm.
if you want to work with veterans and you're struggling and the VA is not going to acknowledge you because you don't take insurance, go talk to Luke and his team there. So, all right. I think that's everything.
Yeah, I think we I think we covered everything.
I think
there.
we did good. All right. I think this was an awesome episode. This is definitely an area that a lot of people don't know about. So currently, ValorWell is focused on Champ VA, but they are opening up, looking at community care to see how they link in there and possibly even TRICARE. And those will be some interesting hurdles. And maybe another year we'll bring them back to see the update where he's at.
Hopefully, it will be a whole new beast there.
A whole new beast. That's right. All right, everybody. So I want you guys to do what you do best and share the word. If you like this episode, please go ahead, and we're all over Facebook under Coming Home Well. Give us a like, give us a share, smash the button is what they say all the time. And we just want you guys to keep listening and keep getting these resources. And if the resource works for you, let us know. And if it's a resource that you don't need, but somebody else could, please share it with them. That is our goal, to get all these resources out to the veterans and their families out there. And civilians, you guys get to learn about a little bit of our lives and kind of the struggles that we deal with. And if y'all want to get involved, just reach out to cominghomewell.com, send an email. All the emails that are directed to me will come to me for Beyond the Front Line. So we hope from all of us here at Coming Home Well and Beyond the Front Line that you guys have an awesome week.
Thanks for listening to Beyond the Front Line, a podcast of Coming Home Well. Join us every other Wednesday. And if you enjoyed this episode, please share it with others, post about it on social media, or leave a rating and review. Thanks again. And until all are home and all are well.